decisions have to be made. So, you need to look at surrogate decision makers as an important aspect. Then when you say voluntary, a person is said to be acting voluntarily if decisions are made in the presence of adequate knowledge, absence of psychological compulsions, absence of external constraints. Okay. Now, you can influence the person making decision either by coercion, persuasion or manipulation. And usually coercion is intentionally uses credible and severe threat of harm or force to control another person. That happens very often. You will say, if you don't undergo this procedure, you will die. It may be true, but it is a form of coercion. Okay. Persuasion is, see this person, he underwent this surgery, see how nicely he is living, you will not have any of these problems, and you persuade him. Like for example, when you have to do a colostomy for a patient with cancer of the colon. Okay, it happens very often. Patients may refuse a colostomy, then usually you have the colostomy club members going and talking to the patient and trying to do that. And when these two things don't fall in, it calls into manipulation.
That means communication is not possible. I mean, it will be a bland exchange of facts, period. Is that all that a doctor is expected to do were he to go for the legal and ethical cover? I don't know if I made myself clear, sir.
No, the last part you did not make me clear.
No, I said when if all that we generally say is going to be construed as coercion and persuasion and things like that, what we will be left with to convey to him is mere facts. See, you have an LAD block, LCH,
I agree
right?
with,
all that.
now I got your point, what I am
Right.
trying to say. See, what I am saying is, we will, and part of practice, we use influence. We do use influence, okay, but we must acknowledge that we have used influence. Okay, see, because aware of what is happening, because most of you, I don't think till I put this up, nobody had thought that this could be a kind of influencing people. Okay, this is the idea behind this whole thing. Now, when we talk about voluntary decision making, usually the decision is for the patient, not the doctor, and patient to decide what is in his best interest. This is a very tricky situation for those of us who are brought in a paternalistic mold. I say, so you must do it. And here we are talking of democracy, where patients have to decide what is best in their best interests. Okay, we should help them to reach their own decision. Now, what are the core sets of information that you give when you are talking about informed consent? So, we must give facts that are material in deciding to consent or refuse an intervention, information that a professional deems it as necessary, and you must also give what is the purpose of seeking the consent, nature and limits of the consent that you can do. Okay. Now, when you talk about standards of disclosure, there are 3 different standards that have been used. One is the professional practice standard. Okay, when you are doing research ethics, the consent form will contain all the possible known side effects of the drug or the intervention. But in clinical practice, nobody can talk about all the possible side effects of the procedure that you are undertaking, because it is just not humanly possible that every side effect can be told. So, the judgment that will, if you are sitting in the consumer protection court, would be to understand what is a professional practice. If everybody says if you take anticoagulants, you are likely to bleed. So, if you have bleeding, come to the hospital, that is taken as a professional standard. Okay. Or the other point is, if you have to maintain your internal INR ratios between 2 and 3 is a professional standard that you are informing the patient. Okay. He may do that and he may find that it has come to 6 and he knows that it is danger and he has to come to the hospital and get treated. The other one is to apply what is known as a reasonable person standard. The amount of information that is to be given is determined in reference to a hypothetical standard subject. Okay. This is where we in India try to manipulate. He is an illiterate person, so he does not know that much what the importance is. So, I will just tell him, if you have some bleeding, you come do this test. If the doctor, the lab tells you to come and see me, you come and see me. You burn your throat to. And the third one is subjective standard, where you only take into consideration how much the subject can understand and talk about it. Okay. Okay. Now, when we respond to questions, it is very essential that we should respond to every question honestly that the patient raises. Okay. And sometimes this can be very difficult, accurately and objectively as much as possible. Okay. Now, doctor providing the treatment should obtain consent. When this is not possible, it should be delegated to a person who is suitably trained, qualified, has sufficient knowledge of the treatment and understands the risk involved. Okay. In practice, what happens is very often just before the patient is wheeled into the OT, the nurse or the aide takes a signature, and that will be a blanket statement. I have been explained all the risks of this surgery, and I understand that I may have anything under the sun. I do not have this thing, and that is the wrong. It should be somebody who has been trained. So, either a doctor or a junior doctor or a trained nurse who has worked in that department for a long period of time, who understands what has been, is the person who should take this thing. And doctor has to ensure that before any procedure, the patient has been given sufficient time, information to make a informed consent. Okay. And very often you will see some of the surgeons who will go to the patient in the theatre before he is being induced, tell him about the operation and say, shall we do? That is one practice that many surgeons have. They will go and talk to the patient before the patient is being induced into anesthesia. Now, when we talk about different forms of consent, express consent is what patient indicates the informed consent either orally or in writing. Implied is by the way you behave, the consent. The way the patient gives the hand for examining the pulse implies that he has permitted you to examine him. Okay. So, implied consent is something, and tacit consent is consent which is can be silent or passively by omission, and presumed consent is we decide that the patient would have given us consent if he knew what this was. This happens in emergency situation, like for example, cardiac arrest. You are going to resuscitate the patient. You presume that if this person knew what was happening, he will give you permission to resuscitate. Okay. Deferred consent or future consent is not acceptable ethically. I can't write, if in time that happens, this is the consent that I give for this procedure. Okay. Now, here is another patient, Mr. Raghu, brought to the casualty with chest pain. As he was being examined, Raghu develops cardiac arrest. CM, the casualty medical officer, instituted cardiopulmonary resuscitation. Raghu developed fracture of 2 ribs, and also he developed burns over the chest due to defibrillation. Raghu was shifted to ICU. Did the doctor do the right thing? Okay. He did it right. Okay. Now, there are certain areas where you waive of consent, and one of this is an emergency. Okay. You presume that you are doing it in the best interest of the patient. The second area where you have is advance directives. Unfortunately, in India, we do not have legally give advance directives, whereas in the West, you can give advance directives. That is something like a will you write, say that if I am incapacitated, I cannot decide for myself, I would not like to be on a ventilator, or I would not like to be dialyzed. I would like to inform so and so to take decisions on my behalf if I become incapacitated. So, these are known as advance directives, and here also there are areas like, suppose there is a Jehovah's Witnesses. Jehovah's Witnesses are a group of Christians who believe that you should not use blood for any reason. Okay. So, they will not allow their members in their thing to receive blood from for any therapy or blood products for any therapy. So, in an emergency, the doctors are put into a lot of difficulty if there is a Jehovah's Witness, but we need to honor their decision making. Now, the question comes is, what about suicide notes? The patient says, I do not want to live, I am killing myself. Will you resuscitate this patient or not resuscitate that patient? Usually, you do not accept the suicide note as advance directives because you presume that person who writes a suicide note is mentally sick. He is not in a capacity to decide. Okay, not because of law, it is because of this. Okay. where the consent can be waived is when there is an order from the magistrate to examine, whether it be a criminal case, whatever the case, if you have a court order saying that this person has to be examined medically, you can waive off the consent. You don't have to ask the patient for his consent. You have to examine the patient. Okay. The third last one is physical restraint. You have a very violent patient. You cannot go and tell him, Baba, I am going to put handcuffs on you and tie you to the bed because you are violent. Okay. You do it. Okay. So, in a violent patient, there is a harm for himself as well as to the society. That is why you waive off the consent in this. Now, the question of prisoners becomes, prisoners is another area where consent becomes a very tricky issue. Because if he is an unconvicted prisoner, under trial prisoner, he still has the rights to choose to give consent. Okay. But if he is a convicted prisoner, he loses autonomy. Okay. So, he does not have a choice of doctor or the hospital. But even then, only the British Medical Association makes a comment saying,
Sir, is he not a human being?
Pardon?
Is he not a human being? Because he's convicted does not mean that he cannot be.
When we talk about it, that's a big discussion. Okay. After we finish this, we will talk about prisoners and human rights. Okay.
Okay.
Because when it's only 35 minutes I have. Okay. So that's a good point that you have brought, because prisoners is this. Only the British Medical Association makes a distinction saying a patient may not have a choice of, a prisoner may not have a choice of choosing the doctor, but the doctor still has to get consent before doing procedures on the patient. Okay. Now, certain areas, consent to procedures that may not be of interest to the patient. Like for example, organ donation from live donors. Okay. Here, why should a person who is rational donate his organ? What is the consent behind this? Here you think of altruism. Similarly, when you ventilate a brain dead patient, to harvest the organs. Okay, the minute the patient is declared brain dead, organs are not harvested. They will find a suitable recipient and then only harvest the organs. Okay. So, here again the question comes as, who gives consent for this thing? And you have the laws which permit the next of the kith and kin to give permission for that. Procedures on dead patients. This happens very often in medical schools. The patients, before the mannequins came about, at least I learnt intubation by doing it on dead patients. Okay. And there are certain procedures which patient will be there. Previously, we never used to ask permission from the relatives or anybody. Screens used to be drawn and it used to be done. But now, we need to get permission from the relatives before you do this type of procedures on dead patients. Okay. There are certain areas which is again with lot of controversy for special treatment. Psychosurgery. Person is very violent, or for example, is a sexual offender. Okay. Either you can castrate him or you can knock off his frontal lobes. He is a danger to the society, menace to himself, so you are providing this thing. It is a very dicey situation, because there are some courts which have allowed this type of surgery to be done on patients who are sexual offenders. The second thing that has happened in our country is also hysterectomy in mentally challenged women. Okay. Why not tubectomy? Why hysterectomy? Because the point that they talked about is, it is very difficult for a mentally challenged woman to have menstrual hygiene, and it is difficult for caregivers to take care of it. So, in Pune in 1995, one of the mentally challenged homes, one of the mothers went and asked to have a hysterectomy done on her daughter, because she said, every time she menstruates, she is making a mess of herself, and I do not know when she can get pregnant because I cannot take control of her. She asked for a hysterectomy, and there was a hue and cry. Ultimately, Sharad Pawar was the chief minister at that time, and he put his foot down and said, yes, what the mother says is right. Hysterectomy will be done, and it will be done in the government hospital. Okay. Fertility surgery is again another issue, where certain types of surgeries, sterility taking place, you need to get consent from the spouse. But because of the ruling that is there in the family planning on the government of India, it does not apply so much in our country. And lastly, paternity testing. Okay. Whose interest are we serving when you do testing a paternity? It is not definitely the child's interest. Okay. It is that there is a conflict or dispute between the parents and you are trying to test the child. So, when it comes to this type of thing, you must have a court order before paternity testing can be done. Okay. Then a written consent is preferable before we do any procedure is performed, and if the data is used for studies or audit, and by the medical council code, all surgeries should have written consent. Okay. Then consent form should detail the key elements of the discussion for the patient, including the nature of information provided, specific requests by the patient. Details of the scope of consent given should be recorded in a consent form. It is not just the standard legal wordings that matter, it is a procedure that matters. Okay. And consent can change over time, and as long as the patient does not patient gives a consent for some surgery, as long as the patient or some procedure or some treatment, as long as the patient does not object, consent is valid. The minute the patient objects to the treatment, then the consent becomes void. And at that time, we need to decide whether the person is acting autonomously, is the change consistent with character, or is the person competent. Okay, this has to be decided when the person wants or withdraws from the treatment. Okay. And just because we have a written consent, it does not mean